Jordan. I'm the physician assistant student here today to do your evaluation. Can I just confirm your date of birth and your name?
Yeah, my name is Roger Jones, and my date of birth is July 1st, 1970.
Perfect. I've got you down here for a sleep evaluation just to talk about some of your daily habits. Is that okay with you today?
Sure is.
Perfect. So I'll just ask you a few questions and we'll just talk about it. What brings you into the clinic today?
My wife finally convinced me to come in. She says I snore really loudly, and sometimes I stop breathing when I'm asleep. But I'm also really just tired all the time.
Okay. Could you tell me more about your sleep?
Yeah, I've been feeling really tired for the last couple of years, but over the past 6 months, I think it's just gotten worse. It doesn't matter if I sleep 10 hours, 12 hours, or 4 hours. I'm just always tired.
When did this first start happening for you? When did you notice this?
Let's see, maybe 3 or 4 years ago, but she says the pauses in my breathing have just been, I don't know, maybe worse over the last year.
Okay. Your wife, tell me more about how she complains. Does she say you snore, that you wake her up, or anything like that?
She says I usually wake her up in the middle of the night. And then snoring, she says I snore really loud.
Okay.
Sometimes sounds maybe like a chainsaw, maybe like a bear, depends on the night.
Okay, yeah. No, I definitely understand that. My dad snores all the time. Does this like worry her a lot, or is it just something that kind of nags her a bit?
I think it kind of worries her just because I stop breathing sometimes in the middle of the night, so it kind of scares her.
Yeah, that can definitely be very scary. I can completely understand why she told you to come in today. Tell me more about like just your past medical history and stuff like that. Do you have any high blood pressure?
Yes, I do.
Okay. And what about any diabetes or heart problems or anything like that?
Yeah, my doctor said I was pre-diabetic last year.
Okay. And when you said you were waking up still feeling sleepy, tell me about that.
Like I said, I could sleep 10 hours, 12 hours, or 4 hours. I'm always tired no matter what.
Okay, like when you're like watching TV, when you're driving, when you're at work.
No matter what, I'm always tired,
Okay.
even when I'm driving. Sometimes I fall asleep while watching TV.
Okay.
Not while driving, but I do get sleepy while I'm
Okay.
driving.
What do you do for work, by the way?
I'm a truck driver.
Oh, yeah, that's definitely something that's very scary. We don't want you falling asleep during that.
Yeah, no, because I drive really long days some days, so
Okay.
I can't be falling asleep.
Yeah, no, definitely not. Are you on any medication at the moment?
No.
Okay. And what about any alcohol, drugs, anything like that?
I do drink some beers on the weekend, and I quit smoking a few years ago.
Okay. And what about your diet? How would you say that is?
My diet's terrible.
Okay.
I'm a truck driver, so I eat a lot on the road. I eat a lot in my truck. I eat terrible, I'll be honest.
Okay. Yeah. Thank you for being honest with me. That's really
Yeah.
going to help in this evaluation. How does the lack of sleep really like affect your mood throughout the day?
I'm kind of irritated just because I'm tired no matter what.
Yeah, that's completely fair. What about any stress, recent stress in your life? Has anything been really upsetting you?
My kids kind of stress me out. My wife kind of stresses me out 'cause she's nagging me all the time because
Yeah.
I'm kind of irritated because I'm tired. I don't know, life's just stressing me out.
That's completely fair. I completely understand that. I'm sorry that it's something you're going through. Okay, so based on our communication and talking, I think you might just be kind of at risk for a disorder called obstructive sleep apnea. So I'm just going to perform a little questionnaire. It's kind of be a little repetitive of the questions I've already asked you, but just answer them again. Just humor me. But this is just going to evaluate you for obstructive sleep apnea. So I'm just going to ask you a few questions, okay?
Alrighty.
Alrighty. Would you say you snore loudly?
My wife says I snore like a bear.
Okay. And then how often are you tired?
Every dang day.
Yeah. Okay. And then has anyone observed you like stop breathing when you're sleeping?
My wife.
Okay. And do you have high blood pressure?
Yes.
Okay.
But I don't take my meds.
Okay. Well, that's something we'll talk about at the end of the evaluation. That is something you definitely need to, because we want to make sure to control that blood pressure. But we'll talk about that at the end.
Okay.
Do you happen to know your height and weight?
About like 5'10", 5'11",
Okay.
somewhere between on a good day, you know what
Okay.
I'm saying? And about 250.
Alrighty. And I'm just going to use that for further evaluation of your BMI to calculate that in your score. And then you were 55, is that correct?
Yes.
Perfect. And then has anyone told you recently that your like neck has gotten larger?
I feel like I kind of got a big neck.
Okay, that's fair, but okay, I'll take that. And then remind me of what your assigned gender at birth was.
Male.
Okay, sounds good. Based on what you shared with me today, I do feel that you're pretty high risk for obstructive sleep apnea. So this is just a disease where the muscles in your neck kind of relax and your tongue kind of falls back to the back of your throat and kind of blocks that air passage. So then it wakes you up in the middle of the night because you can't breathe anymore. So that's why it's been affecting your mood, your poor concentration, your mood changes, and kind of feeling tired even though you feel like you've been sleeping a lot. You're not getting good quality sleep, and that can affect your day to day. So I'd like to sign you up for a sleep evaluation, even though the stop bang questionnaire was for this. A sleep evaluation is very helpful in getting a definite diagnostics. There is a thing called a polysonogram, which is an in-lab sleep overnight study. And then we also have an at-home study that's kind of a bit more on the financial better side. Because I did know you said that you were worried about stress and stuff like that with work. That in-home thing would just be a finger probe. They'd place it on your finger, and then you'd take it with you throughout the night. If you got up to use the bathroom, you'd leave it on and you'd keep it. For now, do either of those sound good for you?
I guess I'll do the at home.
Okay, yeah. No, we can get you set up with that. And for now, I'm just gonna recommend some weight loss. Make sure you're getting about 150 minutes per week of exercise just to help with that decrease in weight loss. Now your diet, I know you're on the road a lot and you eat a lot of fast food, but try to pack lunches, eat as healthy as possible when you can. If you are gonna stop and get some food, maybe try a healthier option. That can help with a lot of symptoms and help with that weight loss. In addition to that, we want to reduce any like caffeine things that you're using. Do you drink caffeine?
I do. I drink some coffee.
Okay, so 1-2 cups of coffee isn't bad, but we want to make sure that we don't go exceeding that. We also want to avoid any sedative medication because although you are waking up in the middle of the night, if we sedate you, then you won't keep waking up, and then you completely it would be bad because when you're waking up, it's your body telling you that something's wrong. So we want to keep that to happening. We don't want to stop that. And if you were to come back with sleep apnea, we would recommend a CPAP, which would be continuous positive airway pressure, which would just give you air while you slept and help that from obstructing, make sure your brain and everything's getting positive air throughout this thing. And I did want to mention, I know you said you weren't taking your medication for your high blood pressure, but that is very important to keep taking because we want to make sure that that's under control so you don't have any further problems. And your weight loss and diet modifications can help with your pre-diabetic status, okay?
Okay.
Does that sound like a plan?
Solid plan.
Okay, perfect. Good to see you.
You as well. Have a fabulous day.
You as well.
During today's visit, I talked to the patient about the sleep studies, the polysonogram, and the in-home sleep evaluation. I did talk to him about the use of a CPAP and how that worked to give air while they were breathing so they didn't stop breathing anymore, and that is indicated for his moderate to severe sleep apnea evaluated during the stop bang evaluation. I did talk to him about lifestyle modifications, which included weight loss, physical activity, and I did also talk to him to avoid the use of any sedative medications, especially since he is a truck driver, so that can affect a lot of things there. I did talk to him about regulating his sleep schedule as well. Throughout the visit, some things that could have been a problem, including some social determinants of health, what could be financial needs. So like I said, I talked to him about the in-lab sleep study and the at-home and the price difference between the two. People don't have a lot of financial needs, especially when it comes to healthcare, so this could have been a financial problem or a setback to his care, so I did talk to him about that. Also, transportation to an appointment, though that can be something that people struggle with in that area, along with being able to get off work. Being able to get off work to do an overnight sleep study could be something that's very detrimental to the financial responsibilities of the individual, so that is something we had to consider when talking about the sleep study. To also, in some areas, in some demographics, some people have less access to healthcare. So this can be included as a social determinant of health and keep people from being able to access healthcare that they need. During the evaluation, we did make a shared decision to do the in-home sleep study and to set him up with a CPAP specialist. It was very good to make a shared decision to make sure that the patient felt like they were involved with the process. During the interview, I think I did a good job about asking open-ended questions to make sure the patient was able to tell me what they wanted to know, and what they felt was important for me to know. I think I was very personable in the interview, and I tried to show empathy when talking about difficult situations. I did try to connect with the patient while they were talking, so it wasn't just they were talking at me. I was very engaging in the conversation. I did discuss both the physical and emotional symptoms and how they were affecting his daily life. I validated his experience and told him that it was something that was very hard to go through, and I appreciated him for being here today, which I think I did very well at, and I didn't use a whole lot of medical jargon while talking to him, so I made it seem like we were at the same level instead of that I was above him. Something that I could have done better throughout the experience is I could have connected a little bit more with the patient to explain our relationship and help us have that patient-doctor relationship and communicate better with that. I think I could have explained a little bit more about what was going on and how it is it's serious but not life-threatening as long as we can get a CPAP on him and make sure that he's taking that. I did talk to him about medication adherence and make sure he was taking that blood pressure medication. I think I could have educated him a little bit more about the dangers of high blood pressure and how it is a silent killer. So that is something that I could have done better.